We'll demonstrate a lateral transfer of a patient in theatre featuring a SALLYBOARD and 2 Slippery Sally slide sheets. You'll learn how to laterally transfer a patient to the operating table in one motion, as well as 2 stages. Firstly, let's take a look at lateral transfer of a patient to the operating table in one motion. In the event of the patient not being able to wriggle across to the operating table themselves, a SALLYBOARD may be required. Be prepared with your SALLYBOARD and 2 slide sheets on the receiving surface. Align the trolley with the operating table and apply the brakes. Create a height difference between the 2 surfaces of about 3 fingers for a small downhill gradient to push across. As you're rolling on a narrow surface, only roll the patient as far over as needed to insert the board safely. Gently slide your SALLYBOARD across to bridge the gap between the surfaces and tuck the 2 slide sheets under half of the patient. Cover the head and cover the heels. Gently lower the patient back to supine. Part of their body will rest on the SALLYBOARD. The receiver should have easy access to plenty of slide sheet without overreaching. The other carers push on the patient's hip and shoulder. The receiver holds the top sheet only and remains close to the edge to act as a body block. The transfer is completed in one smooth motion. Make any final adjustments to the patient's position. Using 2 slide sheets out in full provides friction-reducing benefits for both patients and staff. Repeat the roll if necessary to allow just enough space for another team member to slide the board out. A clinical judgment needs to be made about leaving the sheets under the patient during the procedure or removing them at this point. In this next video, we laterally transfer back from the operating table in 2 stages. Patient factors may indicate a need to complete a slower transfer in 2 smaller stages rather than one motion. Repeat the setup procedure as previously demonstrated. Engage the brakes once you've aligned your surfaces and set your 3-finger height difference. Roll just enough to make space for your SALLYBOARD to slide under the patient and bridge the gap. Tuck your 2 side sheets under half the patient. Be sure to cover the heels and the head. Again, the receiver pulls on the top sheet only, which should be within easy reach. As with any team move, a leader should control the timing by calling ready, set, slide. You'll stop at halfway, so coordinated effort here is key. Be careful with the heels. In some cases, have a carer support under the patient's heels to prevent any skin trauma. Stop to check all attachments, etc. before completing the second half of the transfer. This transfer was completed in 2 stages. Remove the SALLYBOARD with the reverse procedure demonstrated previously. Repeat the roll if necessary to allow just enough space for another carer to slide the SALLYBOARD out. Here's our 3 top tips. Be prepared with your SALLYBOARD and 2 slide sheets out in full on the receiving surface. Take care to align the 2 surfaces. It avoids repositioning later in the case. And be safe by double checking the brakes are secure and the receivers are standing close to act as a body block.